Welcome to the channel where we educate you on how to keep the pulse on your blood pressure. The more you know, the more proactive you'll be in making the right decision at the right time and prevent complications and crises. Have you ever wondered what those blood pressure numbers actually mean? It's quite fascinating, really. Blood pressure is a vital part of our overall health, acting as the force exerted by the blood against the walls of our blood vessels. This force is what keeps our blood flowing, allowing oxygen and nutrients to reach every part of our body. Now, when we talk about blood pressure readings, we're usually referring to two specific numbers. You've probably seen them written as one number over another, something like 120 over 80 millimeters of mercury, abbreviated as mH. It's a bit like a fraction, isn't it? But unlike the fractions in mathematics, these numbers tell a tale of our body's health and how well our heart is functioning. Now, you might be asking, what do these numbers stand for? Well, these are what we call systolic and diastolic pressure. Firstly, let's dive into the top number, the systolic pressure. The heart, a tireless worker, beats around the clock, pumping life-sustaining blood throughout our bodies. Each beat creates a wave of pressure that ripples through our arteries. This pressure, at its peak, is what we call systolic pressure. It's the force exerted on the walls of our arteries when our heart contracts and pushes blood out into the body. Picture a river at full surge, its waters pressing hard against the banks. That's akin to your systolic pressure. A typical systolic pressure is usually around 120. However, this number isn't set in stone. It can fluctuate based on a variety of factors, including age, lifestyle, and overall health. So remember, systolic is the force when your heart beats. But what about that second number? Now, let's unravel the mystery behind the bottom number, the diastolic pressure. What is it exactly and why is it relevant? Well, when your heart is at rest, in between beats, it's the diastolic pressure that's doing the work. It's the force that your blood exerts against the walls of your arteries during these restful moments. Imagine it like this. When a wave crashes onto the shore, there's a moment of calm before the next wave comes. That's your heart at rest. And the diastolic pressure is like the water gently lapping at the sand. So what's a normal diastolic pressure? It typically hovers around 80. Yes, that's right, around 80. This number can fluctuate based on a multitude of factors, such as age, lifestyle, and overall health. So diastolic pressure is the force exerted when your heart is at rest. But how do these numbers come together? You might be wondering how these two numbers work together. Well, it's quite a fascinating dance, really. Systolic and diastolic pressures, they're like partners in a tango, each with their own steps but moving in harmony to keep your heart pumping and your blood flowing. Consider systolic pressure as the force exerted when your heart beats, pushing blood through your arteries. Now, the diastolic pressure, that's the resting phase, when your heart relaxes between beats. It's a rhythmic, continuous cycle. One cannot exist without the other. These two pressures, they're equally crucial in understanding your overall blood pressure health. It's not just about having high or low readings in either number, but rather how these two numbers interact. They're like two sides of the same coin, and any imbalance could indicate potential health issues. Both systolic and diastolic pressures are equally important in maintaining a healthy heart. But what are the key takeaways? So let's wrap up what we've learned today. We've journeyed through the fascinating world of blood pressure, understanding the significance of those two numbers that make up a reading. The first, the systolic pressure, indicates the force exerted on your artery walls when your heart beats. The second, the diastolic pressure, represents the pressure when your heart is at rest between beats. A normal range would be a systolic pressure less than 120 and a diastolic pressure less than 80. These numbers are pivotal in maintaining a healthy heart, as high or low blood pressure can lead to serious health complications. So the take-home message is this: keep an eye on your blood pressure and don't hesitate to consult with healthcare professionals if you have any concerns. After all, knowledge is power, and understanding your blood pressure is a crucial step towards a healthier heart and a healthier you.